Okay, so today we are working on tooth 29 and we're placing a dental dam. So first I'll use my template and my dam to mark the spots. I'll mark 30, 29, 28, and 27. I'll use my dam puncher to mark the holes. So I have that punched, and then now I'll place the clamp. I'll place a clamp on the one behind the tooth we're working on. So I'll place my clamp on tooth 30. Okay. So I have that. And then I'll place my dam over the clamp and then surround my teeth with it. I always start with the clamp first, so I'll place this around the clamp, and I want the most posterior one. And then from there, once you have that one over the clamp, you will just form it around the rest of my teeth, and then I will go back. And then first, I always take my cotton forceps, pull the dam completely around the clamp, so I have to get it all the way over, which I have, but then I need to go back and pull it back over to 31 to make sure that is covered. So I've done that. And then I just make sure it's formed, and then I'll place my dental frame, which helps keep the dam tight. Once my frame is on, I go back and I take my floss and I push the dental dam in between each tooth. And then instead of pulling it out from one side, you push it down, and then you'll just pull straight up on the floss. Down and pull straight up, just so you don't drag that dam out again. Okay. Then I will go back and I'll use my wedge it. I'll place it on the most anterior portion. This stabilizes the dam. And then I would cut that, but right now I don't have scissors, so then I go back and I just make sure my floss is good. And adjust my frame from there. And then my dam is complete. I can go back and I'll use my Explorer usually just to make sure that it's completely over every tooth. It's completely, the site is cleared, stabilized, and no portion of the mouth is at risk for us to drop anything in it. So then removing, first I remove, also once my clamp's in place, I have that piece of floss around it to as just another safety precaution. Okay, so there's my completed dam. So then taking it off, I always take my clamp off first. My clamp is off. Then I usually take my frame off. Some people take that off with the dental dam, but I usually take it off. So that's off. Okay, when you're removing the dental dam, you want to make sure you don't allow anything to drop. You don't want to just rip it all up. I personally like to remove as much as the wedge as if I can remove it. So mine popped right out. When removing the dam, you want to remove from the lingual and then you want to cut. This one, mine usually slide right off, just like a draw. You want to pull from inside to out, so lingual to facial. Okay. So mine came off. You want to just check your dam, make sure there's no pieces missing. So, and then you'll take your mouth mirror and your Explorer. Show my mouth mirror. Check, make sure nothing's stuck in there. You don't want anything left in your typodont or your patient's mouth. So once that's clear, I usually take my floss again. And that's it. I have no more remains of my dental dam.